South Korean pediatric care is on the verge of collapsing. The shrinking number of hospitals offering medical care for infants and children comes as the country records the lowest fertility rate worldwide. South Korea's total fertility rate, the average number of children a woman bears in her lifetime, came to 0.81 children in 2021, down from 0.84 the previous year. As a result of the ongoing decline in childbirth, pediatric care is among the least preferred medical specialties. A growing number of pediatric emergency rooms recently closed due to a workforce shortage. According to the Korean Pediatric Society, applications to pediatric residency programs have declined in recent years, going from 80% in 2019, 74% in 2020, 38% in 2021, 27.5% in 2022, and 15.9% in 2023. It also suggested that only 36% of the country's teaching hospitals provide 24-hour service for pediatric patients. On top of that, another reason for the sharp drop in pediatric service is a worsening profits. Compared to other medical fields, there are fewer non-benefit items in pediatrics because the country's insurance benefit covers it. Some even say the medical expenses for one cosmetic patient, such as plastic surgery, is similar to the medical expenses for 50 pediatric patients. Medical fees are too low to keep pediatricians in the field, and because of the lack of new recruits, existing pediatricians are required to work longer hours. Also, young patients are more challenging to treat than adults, requiring more medical staff and higher labor costs, as well as the added burden of having to deal with anxious and often angry parents. Parents and children are already feeling the effects of the sharp decline in pediatric care. Children who show up in emergency rooms will likely not get the treatment they need and will have to travel farther to find an emergency room with a pediatric specialist. Last month at a press conference, experts voiced their worries saying pediatric teaching hospitals across the country are facing the worst manpower and medical crisis.
지금 초조 출산이 세계 유례없는 그런 수준까지 떨어졌고 소아 진료의 특성상 많은 시간과 업무 강도가 높은 데 비해서 비정상적으로 낮은 보장 수가 때문에 벌써 코로나 팬데믹으로 인한 40% 진료량 격감으로 1차 진료가 붕괴되기 시작했습니다.
Medical experts have called for emergency measures to improve the situation, such as financial support from the government for hospitals to hire more medical staff, enacting special laws, and establishing a relevant department.
정말로 소아 진료 시스템이 그대로 무너지지 않을까.
Amid growing concerns, the Ministry of Health and Welfare recently announced that it had started a pilot project to compensate for medical losses in the pediatric field. Participating institutions will be compensated for medical losses through annual performance evaluations for 3 years until December 2025. The pilot project will provide the 9 participating institutions with essential personnel and medical resources.